Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. Hope you're doing well. As you know, today we're going to talk about a variety of cool things, as we always talk about cool things. And Frankie will be the first one to tell you we talk about cool things. We'll talk about some studies, some of the interesting components of diet, sleep, how people that are super agers, that are brilliant and functional beyond age 80, how they manage to do that. How a high-fat, high-sugar diet is so bad for kids that it sets the stage for bad diet choices as you get older. So a lot of interesting things. And, of course, we're going to take your calls and your texts, your questions here. The phone number, 1-888-420-9272. If you'd like to call in, you could do so. Otherwise, just send us a little text and we'll chat. Thank you for everybody listening, especially our Rumble LFA fans. We're breaking all sorts of barriers. We've surpassed 300,000 views now, so that's pretty cool.
Oh, yeah. Let's go. And I see the
next
chat.
goal is to break 400,000.
Oh, yeah.
You know, so this is fun.
And shout out to just Rumble. I see we're on the front page right now. Let's go. I see Log in the chat. We got a question already. Why does sugar have to be bad? That's possibly a joke, but yeah. I mean,
why does it have to be bad?
What does bread have to be bad?
Yeah, I mean, you know, everything's bad for you probably tastes the best. Sugars and fats and salt, you know, that's pretty much how it goes. Food companies are putting lots of sugar, fat, and salt into foods to get you addicted to them, and chemicals and all that nonsense. But sugar is as strong an addiction as anything else, because when you take in sugar, your body feels good when your blood sugar elevates. And then when it goes up too high, you release insulin to control the blood sugar. You bring the blood sugar down, and sometimes you release too much insulin. Your blood sugar crashes. You're anxious, irritable, panicky, tired. You want to have more sugar. And you just go through this back and forth of up and down with your sugar. And we know that sugar damages your blood vessels, your nerves, your organs, your cells individually. Glycation is the term for all that. So it's something that the traditional approach has ignored for many, many years. And we've been saying it's not really fat as the bad culprit, but sugar. And we've been able to prove that and document that now. Look at diabetics and all the problems they have all over their body with every cell, every tissue, every organ. It's from excess sugar causing that damage. So, yes, why does sugar have to be so bad? Reminds me of a movie called Defending Your Life with Meryl Streep and, what was the name of the guy? Albert Brooks. It's a funny movie where they both die and you have to review your life and defend what you did in your life. And, of course, she had a perfect life, and he never stood up for himself, and he's always battling these issues. And so for her, she has an attorney, and so does he, getting in front of some kind of theoretical judge in heaven or the gateway towards heaven. And she's so perfect that she flies right through everything. She can go to a restaurant, eat cakes all day long, don't affect her, eat all the sugar, all the things that we thought were bad. And then, he goes to a place where he can't really eat anything because, he's just on the wrong end of the spectrum. And then at the end, it's a great ending where he decides he's madly in love with her. She loves him. And then he breaks the chains and gets off this bus that he was going to some bizarre place and races after her. And then they see that he does this, and that's the proof that they needed for him to be able to follow her and exist with her in heaven or some sort of realm. But she's eating cakes and pies, and he can't have any of that, and he's just sad.
Just a comment here on Rumble. High fat is not bad. Needed for brain. Yes, fat bad for every part of our body's terrible drug.
So you do need fats for hormone production, and people that do very, very low fats typically have hormone production problems. And there are fats that are good for your body. And obviously plant sources of fat are better than animal sources per se. And in part, some of the animal fats just had so much bad stuff injected into the animal that's really why it's bad. But I tell people they could have a little bit of fat. Butter is better than margarine. Margarine is horrible. You could have fat in your milk. You could have fat from ghee or a variety of sources from avocado, olive oil. So you do need some. And we recommend that.
All right. And people are asking what the phone number is to call. I don't want to say the phone number right now because my controller that controls the phones, it's not connecting correctly. So I'm working on that in the background.
We'll give it a few minutes.
Yeah, I see you log in the chat.
Let Frankie do his thing. We'll get your phone calls up. We'll be here for like an hour and a half anyway.
Yes, and for now, you could always write in the chat. I see the chat, guys. And I do have a comment over here. I don't know if you saw this. I had not seen it. RFK Jr. challenges Dunkin' and Starbucks over safety of sugary drinks.
Awesome. Love that guy. Must interview him. If I have to make it my life's work, I must figure out how to interview him.
2 days ago that was.
But I have to reach out to people that know him. Got to work on that. So a high-fat, high-sugar diet, and talking about all of this, may leave lasting changes on the brain and cause problems with eating later on in life. Now, of course, the average person would know the more carb you eat, the more carb you want, the more you crave. Same with the sugar. And it's bad. And same thing with salt and fat. And for people that are smart enough to read and learn, and which we try to get everybody to read and learn and listen to some of the things that we're talking about, once you start to dig in and get a little bit of research, it's great because it leads your mind into the right place. Then you start to question what's good, what's bad as well. If you start to take the carbs and the sugars out of your diet and get rid of the junk food and you feel that much better, you say, wow, you know what? I'm going to stay with this because this makes me feel great. Oh, look at that. I've lost a little bit of weight. My energy's better. Went to the doctor. My cholesterol dropped by 20, 30 points. So there's a lot of good that happens when you start to see your body change when you take the bad things out of your diet. Go ahead.
No, you can keep going.
This was a study published in the Journal of Nature, and it talks about early eating habits and affecting lifelong brain health. And consuming unhealthy foods gets people to consume those things down the road. There's a biochemical mechanism for that, just as I mentioned, high sugar, insulin release, low sugar. Also, people, when they're stressed out, because everybody's stressed out every day, all the time, everywhere, people tend to think, or they go back to what they feel are the comfort foods they had when they were younger. And if they're bad foods, you're going to start eating the bad foods again. It'll make you feel worse. So I tell people we have to look to see what your body's reacting to. Let's say you're allergic to something. Let's take those foods out of your diet. Let's put together great foods for you. Watch this and see how you feel with great foods on board. And start to document that. Put that in your journal. Put that in your daily writings, breakfast, lunch, dinner, snacks, exercise. Start to look at all this, write things down, get engaged, get involved, and you'll start to feel better and better. Look for articles on Google Scholar. This is what we tell everybody to do. So it's a great way to understand what's happening, learn about what's happening, and help to improve your body.
I got a side comment here. What is your take on, forgive me if I pronounce this incorrectly, Shilajit? Shilajit. And it said, and then the follow-up is, just started taking it, and I'm having some vivid dreams.
Yeah, so there are a lot of things that you could take, and some are mushroom-related extracts, and some come from molds and in different sources. But my comment typically is that it's hard to know whether or not something like that will be beneficial for you because your body's never meant to have it. If we talk about correcting NAD, which your body has massive amounts of when you're young, and you lose it as you get older, it's there to take oxygen and make 36 molecules of ATP energy from it. If we talk about correcting testosterone, thyroid, DHEA, female hormones, estrogen, progesterone, your body's meant to have all of that. IGF-1 or Somorelin, the active component of growth hormone. That's great for memory, focus, concentration, hair, skin, nails, endurance, strength, sexual drive, and function. So, and I tell people, as opposed to grasping for something your body's never seen or had, even though it may be a plant extract or healthy for you, it may not give you the benefit. And there are patients that I have that jump on the peptide bandwagon, and they're going online and buying peptides and trying everything. I said, you're never going to know which things are giving you benefit. Also, you can't buy peptides online that are cleared for human use. And people don't understand that. They say, well, I went to the site. Yeah, but read what the site says in the fine print. This is for investigational purposes only. This is not meant to be a suggestion for human use. So for a lot of the things that people are taking and waiting to see what happens, you're taking things that aren't made in a strict, controlled, sterile environment, as the compounding pharmacies that are allowed to do, and doctors can only buy from compounding pharmacies, not places that aren't certified, as having sterile environment with their manufacturer. So you can't do that. Be very careful what you're told to do or suggested to do out there, because you may not be getting what you think you're getting. And what about the potential contamination? Because they're not made in sterile environment. All the compounding pharmacies we use in Florida, up here, great compounding pharmacies, when they're making the injectable things, it has to be made in sterile environment. So that's the only way we're allowed to do that, and it's the only way it should be done.
All right. We had a follow-up from the Shilajit, just saying it had 80 trace minerals in it, organic. And then a side note, someone mentioned, sugar, horrible, terrible drug was the sugar, not the fat. That was a correction. And then agree, animal fat bad if animal raised improperly. Poor animals should be fed as natural, originally in nature originally intended.
Of course.
And I see you YouTube. Don't worry, I see you.
I think about this a lot, and I talk about patients going back 50 or 100 years. There was really no junk in the food, no chemicals, no colorings, dyes. This happened, quote, more recently. So 100 years ago or 200 years ago, you went to a butcher and everything was just fresh, and nothing had to sit around in a supermarket with injections and colorings and this and that to make it look appealing, because it's there for who knows how long, a week, 2 weeks, 3 weeks. And I think that a lot of countries, and in Europe, I've seen this every time I've gone, you get really, really fresh food. Either it's made in a garden, things are grown in a garden near where the restaurants are, and all the restaurants own the garden, so they're using that, for their food for people. And whether it's fish or meat, you're getting things that are just slaughtered in maybe hours before. I went with one of our good friends, Paul, who Frankie reintroduced me to my best friend from my first year of college, because his parents are friends with Paul, and I hadn't seen Paul, in 47 years. So I called, we got together, and we've had dinner a bunch of times. And it's great to reconnect with somebody that, was a great friend back then. We drove to Arthur Avenue, which is this little outpost.
Time machine,
yeah, in the Bronx. And if the cars were 1950s cars, you would swear you're in 1950. Newer cars, but the buildings are old. The stores are old. Everything inside the stores looks like it's back in the 1950s. And we bought some homemade ravioli. This is right before Christmas time. Brought the fresh mozzarella that they were making right in front of you. We went into a store. Now, some people may not gravitate towards this, but the storefront is still there. It's been there probably for 100 years. And in the storefront is all this ice, and you have the different types of meats. And you have the whole lamb hanging in the window, because that's what, the Greek people and the Italian people would have. You have the head. We call it cabezel, sheep's head. They didn't waste any part of the animal back in the day. And they had tripe, the lining of the cow stomach, all this stuff, every possible animal that's, common, maybe less common to eat. And inside the store, they had homemade sausage, which is unbelievable. And it was really red. I mean, it wasn't, meat that was already gray and who knows how old it was. And then there's a bandsaw in the back with the guy, and I looked over my shoulder. He's cutting the ribs. He's cutting the spine. I bought some of the T-bone of the lamb, which is spectacularly delicious because it was just fresh. No chemicals, nothing. I don't know what's on the other side of the wall. Not that I really wanted to look or see, but, you saw that they were making and then putting it right, into the case. So, the fresher the better. And that's another reason why I like Moolah Farm so much, is because all the products they have are without chemicals, without preservatives, without any of that stuff. No pesticides. The chicken is terrific. The meat they have there is terrific. It's just a world of difference when you drink things that are the way they're meant to be and have been for thousands of years in every, part of the world, especially all over Europe and Asia, et cetera. This is what people had. Russia, I'm not sure about China, but this is what people had over thousands of years. There were no chemicals. They would take the animal, slaughter it, and use every part of the animal they could, et cetera. And you had fresh food. So I like the fact that you can find and eat things that don't have all the junk in it. And the flavor is a world of difference. You'd never go back to the other stuff.
From the chat, our rumblers, what are your thoughts on stevia, Doc? Another artificial
I think for some people, if you're kind of addicted to the sugary mechanism, that using stevia for a while can help to decrease your craving for sugar. It doesn't have the damage that sugar does to your body, doesn't release the insulin. So it's not as though your body's seeing these huge sugar spikes coming in. And again, I'd rather get a person away from having a sweet tooth than maintaining the sweet tooth with other types of more natural sugars. We'd rather have their palate totally clear and clean. If they taste something that's a little bit salty, oh, wow, it's too much salt. Or if they taste something that's sugary, oh, wow, that's too much sugar. So we'd rather have their palate to be, for lack of a better term, cleansed.
All right, let's see what we got. We got a comment. God's way to health is simple. What is your take on the iodine crisis and health? What can we do naturally to improve that intake? Also, how to combat the effects of glyphosate to reverse its effects?
The glyphosate question is kind of difficult to answer because we don't know of anything specifically that can bind and get it out of your system. There are some doctors, and we do it as well, use phosphatidylcholine glutathione IV combination, which literature says binds to peptides, chemicals, toxins, metals, etc. There may be some advantage there. I have to look that up. There are other doctors in some areas doing a technique where they take blood out of your one arm, run it through a filter, electrophoresis, and then put it back into your other arm and add some proteins and some aminos, and they're taking out some bad components. But I have to see exactly what the limits are on that. What are you actually pulling out? How is that documented and proven? So we're looking at that actively. What was the first part of the question?
What is your take on the iodine crisis?
So there are a lot of people who are deficient in iodine because no one's ever thought about it or heard about it before. But we test the blood for iodine so we can see whether or not you have any. Iodine's good for your thyroid and production and continuation of thyroid function, so it makes sense. Some people in the past, this was sort of the old way to do it, is to take Lugol solution, an iodine solution, and put it on your skin. And if the iodine was absorbed right away, then you need it or more of it. And then you'd put it on every day until you saw that the iodine didn't get absorbed from your skin. Not terribly scientific, but that's what people used to do. I'd rather look at their blood tests, give them a pill, a capsule, and then recheck their blood. Just smarter, because you're able to gauge where to go with that. And same thing for iron.
That's an interesting technique they were using.
Yep. Some of these things were around a very long time ago because they didn't really have that much else in terms of ways to test for it. So I'm not saying I'm against the older ways of thinking about things, but there are new and better ways.
What is your take on Dr. Sebi alkaline diet? I'm not sure what that is.
So we have to be very careful when we talk about alkaline diet. No matter what comments and discussion and sometimes hype and marketing exist out there, because there's a lot. Your body, and only doctors would know this, people that have gone to medical school and have experience in understanding your kidney function and your lung function, because they regulate the pH of your blood. Your blood pH is supposed to be 7.2. Never a point above, never a point below. It has to be at that exact number. If you take in too much acid, your body will pee out the acid immediately. Hydrogen atoms. If you're taking in alkaline, your body will retain the acid to keep your pH the same. You can never control your pH on your own. You can't. Because if you think that drinking alkaline water is going to make you alkaline for an hour a day, it's impossible. Because your body has this immediate system to let that either acid leave or stay. The more alkaline you have, the more acid you're retaining to stay. So you're not going to be able to change your pH by a point up or down. You just can't. The only people that might have issues with regulating pH are people with diabetic ketoacidosis or respiratory alkalosis. But people think that, oh, I'm eating an alkaline diet, I'm having alkaline, and that's going to be great for me. You know, you're not. You cannot make your body alkaline because of that exquisite millisecond to millisecond regulation of your pH. So there's also been commentary on trying to create an alkaline environment around cancer cells. So when sugar is broken down, preferentially by a cancer cell, because it sucks up a lot of glucose to have more energy to grow faster. That's what it does. That's Nobel Prize research by Dr. Warburg, Otto Warburg, back in the 1930s. When that sugar is broken down into lactic acid, if that acid is pushed out of the cancer cell into an alkaline environment, it'll go, but then that'll stimulate vascular endothelial growth factor to put more growth and blood vessel response to feed the tumor more glucose, which makes the cancer grow. If you have an acid environment, ascorbic acid, vitamin C, around the cancer cell, the lactic acid cannot go into an acid environment because it's the same charge, it's the same mechanism, so that backfires on itself, and intravenous vitamin C, IVs, help to inhibit cancer cells. So, and have antiviral effect and improve your immune response. So you have to be very careful about what non-doctor people are saying, because what they're saying may be completely wrong for what your need is.
All right. Let me just check. Hello, all. Good. All right. Hold on. Whoa. Okay, guys. We got questions today. Something's in the air. All right.
Okay.
What about Lugol's 2% iodine? Lugol's?
Well, I mentioned using that, and you can put it on your arm to do that old-fashioned test.
Okay, that may have been old.
Some people will do drops under their tongue or drops in water. Either way. But remember, you have to test your iodine level before, see where you are. Then whatever protocol you want to start, do that and retest it. Should be done with a nutritionally savvy doctor. There aren't many of them. Most doctors do not do testing for vitamins and minerals and such the way that I do, but you want to test, make a recommendation that makes sense, that you've seen work, as I do, and then retest to prove the benefit. It's pretty straightforward.
Hello, all. Good cholesterol is also good for the brain. The medical ruling class has convinced society that all cholesterol is bad. Omit meat as much as possible from our diets. I think I have that close, right? Question mark, maybe.
So here's a great story. As you know, I'm full of great stories. Maybe some of them aren't as great as others, but some of them are great. So many years ago, there was a doctor named Kilmer McCulley who worked at, I don't know if it was Brigham and Women's Hospital, but he was up at Harvard somewhere, one of the affiliates up in Massachusetts or Rhode Island. And at the same time that cholesterol was being thought to be a bad thing, he was researching homocysteine. And homocysteine can cause plaque in your blood vessels if your B6, B12, and folate vitamins are too low. Absolute. We test this on everybody all the time. McCulley was a brilliant doctor, and he was 100% right in also saying that the homocysteine is worse than cholesterol for plaque in your blood vessels. Understanding that there are people all over the world in other countries like Italy and certain regions that have high cholesterol and no plaque at all. So because cholesterol was thought to be only fixed by using drugs, and the drug companies still are running with this, they made a variety of meds, things to absorb cholesterol from your gut, medications to block an enzyme that creates cholesterol, but that also wipes out CoQ10, very bad thing. They couldn't make a drug to lower homocysteine. So the homocysteine research and poor Dr. McCulley, Kilmer McCulley, were sort of ignored because they couldn't make money off it. But they've made septillion, octillion dollars. I don't know what the numbers are as they go past a billion, trillion, quadrillion, quinquillion, whatever the numbers are. They've made freakish money on trying to lower cholesterol. And at the same time, those cholesterol drugs have bad side effects. Now they're saying the cholesterol drugs are a very common cause of dementia, memory loss, cognitive loss, a variety of different things. So I think that if you have high cholesterol, you'd like to keep it in a tight range. I wouldn't let it sit at 350. I wouldn't want your triglycerides, which are sugars and fats, to be very high in the 200 range. You want the HDL to be as high as possible because it decreases risk. LDL, you want to get that in the range of 70. HDL 70, triglyceride 70. That's a good rule of thumb. And total cholesterol 170. So we do try to keep those in a nice range, but you don't want to take the meds and completely wipe out your CoQ10 just to drop cholesterol 10 or 20 points. And there are no studies that say taking cholesterol meds will prevent a heart attack. And as I say, there are people all over Europe that have high cholesterol and no plaque whatsoever. So that's the story of homocysteine and cholesterol.
We got someone in the chat. I get it. Listen, you're seeing us. We're on the homepage. You don't know us from anyone else. But it says, how can anyone trust an MD after the whole Corona marketing?
Wow.
You don't know him at all.
You can see the size of my smile. You can see the response in my eyes. You can see that I think that's an awesome question. Do I need to viciously attack the other side? I think a lot of people understand what happened with that a virus was made and brought to market to do a job, and it did. It killed off a lot of people that had, different medical issues and bad lungs and bad heart or had cancers, etc. I think that it was made to usher in a non-tested, dangerous vaccine. And now we're still seeing all the bad outcome and side effects of that. So, yeah. Hey, people tell this to me all day long in my office. I go from exam room to exam room. There hasn't been a patient in the since COVID started, the last bunch of years who isn't mad at all of that. They're mad and they're angry, and rightly so. But then the other discussion comes into play because you can't talk about the mRNA vaccines and not talk about childhood vaccines. So people are smart, they're aware, they read, they learn, they like someone like Dr. McCullough, and they listen to what he says. They like RFK Jr., and they're listening to what he says, and they're not believing this whole machine that's been created to make you follow their recommendations in their way. So there are a lot of people who are very angry and upset, and sometimes I have to tell them, okay, calm down. I agree with you. Let's do some stuff to fix and improve and help and, blah, blah, blah. But I hear that all the time. Before COVID, it was people were angry at the doctor not explaining their blood work or not doing any vitamin testing or hormone testing, or they didn't test this right or that right. It is what it is. Wouldn't be the first person to tell you that, the approach is not what it really, really should be. But that's been my crusade for the better part of 40 years, to get people to eat right, exercise, test their vitamins, hormones, make recommendations, fine-tune, fix. That's what we do.
Another comment. We are not two parts. Did you take the vax, doc? And we are not buying the narrative from the medical establishment.
Yeah, no, never. Would never taken that. Didn't let my family take it. I knew there was something that was really wrong about it. And the first thing that I said when I heard there was a Johnson & Johnson, that's an old-fashioned vaccine, and then the messenger RNA from Moderna and Pfizer, I said, why would they mess with messenger RNA? Because now you're telling your body to respond to this RNA and not your own? I said, that makes no sense at all. I'm like, this is meant to do something, and it's not meant to do something good. And now we see that. And turbo cancers and all this other crap. Athletes dropping on the field. Everyone's seen this. Everyone's heard this. But they made something that they shouldn't have made. If it were like Johnson & Johnson, without the messenger RNA, I wouldn't have as much of a problem with it. But to get messenger RNA into your body with a spike protein and whoever else knows what the hell is in there. And remember, this country has never given people a true informed consent about vaccines, whether it's children, babies, adults, or otherwise. If you saw a list of what's in the vaccine, you'd never take it. So that's what they threw on us and forced a lot of people to take that. And a lot of people are having big problems from that. So
didn't Johnson & Johnson, didn't that one end up coming off the shelves anyway?
I don't know.
I think that I want to say that's the one that they ended up taking off, and that makes sense because it was the one that probably actually would have worked.
Yeah. Vaccines that have been around that we know, of course, were simple and got your body to go gear up and kill something if that bug came along. If that bug came along.
All right. We got people in the chat just saying, got so much more respect for you, Doc. Knowing.
Thank you.
Someone said, I know that when I take ivermectin, it kills my sweet tooth.
That's interesting because a lot of people talk about different benefits from that. A lot of my patients have taken it, of course, because I thought that was one of the smartest things to use initially, that and the chloroquine. A good friend of mine that I went to medical school with, one of my best friends, who was sad because he had to move back to New Jersey. And he was I'm not going to say a wild child, but he was a great pioneer. When we got through medical school, he went out to L.A., he did a surgical residency, worked at an AIDS clinic, worked with cancer patients, did a lot of stuff. And then 3 or 4 times a year, he would go for a few weeks to Africa to be the doctor in an area where they didn't have doctors for hundreds of miles. And he would treat all sorts of stuff and Ebola and, crazy stuff that the average doctor would never do because of risk. And I said to him, look, what's going on with this? I said, what should we use? He says, use hydroxychloroquine and ivermectin. And we did, and it worked great. And I've had other patients say, I used to have these bumps on my skin all cleared up from the ivermectin. Or this was better, or that was better, or my hair is growing better, or any number of other things. So I believe that a medication like that can work in different ways. We know that ivermectin has anti-cancer activity now, and so does fenbendazole, mebendazole, and albendazole. They're great for your immune response. They enhance your ability to fight infection. So There are multiple things that are good for you. The beauty of the vitamin C IV has anti-cancer effect. It also, again, quadruples your killer cells. So there are great things to do for your immune response. And I've done this with, both patients, friends, and family members, and have had good, outcome, good result with it.
I thought it was for horses, doctor. Just kidding.
Yeah, the horse paste. Well, any idiot that was talking about horse paste, and I know a lot of them, I said, oh, you must not have read that it's a Nobel Prize winning drug for humans. They're like, what? I said, yeah. Look that up.
Does ivermectin help with the flu bug?
I think for some people it's going to have some immune benefit, and I think it may help with the flu and other bugs as well. I haven't seen nor have I really looked at literature specific to the flu bug, but then I always question the flu bug. I question it. But just as I questioned COVID, that's a man-made bug, and ivermectin and chloroquine and et cetera have had benefit against it. Maybe it'll have benefit against another bug or other bugs that seem to pop up every year in September like magic in this country. So I also like the idea of using a medication that's approved for something on an off-label use. And that's been going on in medicine forever. There are medications that are good for your blood pressure, but they also help to shrink your prostate. There are medications that are good for one thing, but they also do something else. Metformin helps to decrease sugar entrance into your cells. So they think that certainly has benefit for diabetics, but it's also beneficial in other areas. So I think we have to look at some of the things that are simple and safe and work and see if they can be used in other areas.
I just love our chat. We got people, people are got us in the background. They're cleaning the house today. I love it, guys. Keep it up. Don't fall, don't stand on anything that's unstable,
Yes.
all right?
Don't fall off your chair.
What do we got here? What can we do to reduce bromides in dough conditioners and go back to using potassium iodinate? Can you explain harms of bromides?
So there are different chemicals that your body would react negatively to in a variety of ways. Some will displace magnesium, potassium. The comment that you make about going back to the good old, safe, simple things makes all the sense in the world because a lot of people were using things that they had no issues or side effects with. And we can go on and talk about chemicals in food, and regular meat's got 75, 80 chemicals, and, chicken may have 60 or 70 chemicals in it. They're washed within some weird, bleach process. And I think some of the bromides are meant to be used to kill infection, but I just don't like the fact that we're not eating the basic, healthy, natural food, and we're just getting all this garbage on board. So I think that we have to go back to the more natural within everything that we do, certainly everything we eat.
This is from before, but what's a good replacement for sugar?
I don't think that table sugar should be used, and I don't think we really want to use a long-term replacement to maintain a sweet tooth. I mentioned this before, but agave may work for you. Stevia might be an advantage, but I'd rather you wean that sugary desire, and with those you might be able to do that and then get off the sugar, completely. For foods, and I tell people this every single day, and it used to be 6 days a week. Now it's Tuesday, Wednesday, Thursday, Saturday, 4 days a week. There are different foods that you can have and ways to prepare foods that taste great, taste sweet, but aren't sweet. So Forager Project is a great company. They make cashew milk yogurt, and it's got 1 gram of carb in the plain yogurt. If you put some berries in there, that's another gram, maybe, of carb. Don't use frozen berries because they add sugar to that. Use fresh berries, organic berries. If you want to put a scoop of protein powder in it, Orgain is one of the ones that I like, and you mix it up, and now you've got a smoothie, and there's no sugar. But it tastes somewhat sweet because of the berries and the yogurt, And the Orgain protein powder has a vanilla flavor. So you're getting no sugar, a gram, 2 grams of carb. So that's one way to do it. If you like oatmeal, I'd switch over to almond milk, chia seeds, and the same protein powder, mix it up, put it in the fridge, take it out after it congeals and gets firm, and it looks and tastes like oatmeal, but there's no sugar, no grain. There's so many ways to do this where you kind of got the taste that you're expecting or you want, but doesn't have the sugar in it.
A bit of a change in topic, but my daughter is trying to get pregnant and has a low egg count. What can she do to increase her egg production?
You've got to look at hormone levels because depending upon age, hormones will control that. You want to see what the estrogen, progesterone. There are 3 different types of estrogen. Look at all of those, progesterone. IGF-1, the active component of growth hormone, because that really helps to stabilize some of the hormones in their production. DHEA, adrenal hormone. I would look at all the hormones. And then maybe if she's got junk food in her diet, take out the junk food, really clean up the diet. Correct nutrients. That's what we would typically do. But our big blood test is like 25 pages, and it looks at everything. I remember a young lady who worked for us as a nutritionist years ago. She had 3 miscarriages. We corrected her hormones, DHEA, I think the IGF-1, and then she got pregnant, carried through, and had a baby daughter who's probably 30-something by now.
Speaking of someone saying they have a Christopher, their oldest is Christopher, 46.
Good name.
Love it.
That's awesome. It's a good name.
Great name. Great name. What about honey? It is structured and natural? Question mark.
It is natural, and if you want to get some natural honey, et cetera, it's not bad. I just wouldn't have a lot of other sugars because it's, relatively pure sugar. You want to put some of it in your tea, no big deal. But I wouldn't have it, 4 or 5 times a day. Might be too much. Everything in moderation, I think, If you're diabetic, obviously it would be bad because it's too much sugar for a diabetic. And they make a couple of different natural things. Monk fruit syrup tastes like maple syrup. If you want to take almond flour and make some pancakes with almond flour, no grain, and, use a little bit of the natural butter. And I forget the name of the company. The monk fruit syrup is no sugar. No sugar in that syrup because it's not really syrup. And no grain from the pancakes, so people that want to do low carb can have that.
Someone's talking about MTHFR gene mutation.
So yeah, methyl tetrahydrofolate reductase, MTHFR, is an enzyme that you need to convert regular B12, which is either hydroxycobalamin or cyanocobalamin, into methyl B12. That's the active form that works in your body. It's like not having a key to get into your house. You don't have the key, you're not getting in. If you have the key, you get in. So if you have the enzyme to convert those 2 types of B12, you'll get your B12. It's great to lower homocysteine, great for your brain, great for energy, lots of things. If you don't have that gene and you're not converting, you could have B12 that's high in your blood, but it just can't get into your cells to work. So we would then give you methyl B12 shots. You can give yourself the shot at home and get your energy back and your homocysteine down and your brain function up.
People are wondering in the chat, average amount of sugar consumption for Americans a year. I'm going to just say higher than it should be.
You can look it up online, how much sugar do average Americans consume. And it's a good idea because it gives people a freaky number to think of and say, wow. The average person doesn't need that much salt in their diet, and probably 500 milligrams or so. But some people are at 6,500, 7,500 milligrams, which is horrendous.
I have the number, Doc.
Okay. Should we have people guess?
Yeah, sure. This is your chance.
How much sugar do people consume on a daily or yearly?
Yearly. Americans.
How much sugar do Americans consume yearly in their diet?
The measurement will be pounds. Okay, guys?
Pounds.
We're going to go pounds. Oh, no.
You know when the measurement is pounds that it's going to be a big, horrible number.
I'm just giving the chat some
Let's
time.
give people a minute or two to call in.
Bit of a delay depending on the platform.
So super agers' brains, people who get to their 80s and beyond that still have great brain function, like my mom, who remembers everything throughout every day of her life. She remembers every vacation we took, what we did, where we went, the horses we rode on. Just amazing. Those people tend to grow more neurons and allow their brain to function that much better. So there's a subset of people that still can have more brain cells made even as they get older. Of course, I think it helps with vitamins, minerals, and hormones. And of course, this begs the discussion of stem cell therapy, because we're taking your own cells from your body, from the crest of your ileum, and putting them intravenously and dripping them in nasally to get brand new cells in your brain. And those cells become brain cells, make the neurotransmitters, and then that person's brain becomes vibrant again. It's all about new cells. As we all age, we're losing cell production in all of our organs, all of our tissues. You can see it visibly on the outside, hair, skin, nails, etc. On the inside, you need blood tests to see if your pancreas is getting tired, or an echocardiogram if your heart's getting weak and not contracting as well. But putting new cells in answers the ultimate, quote, no pun intended, age-old question: how do I change how I'm losing my function as I age? You put new cells in, your organs work better, and you're reversing that. So that's a pretty cool corollary.
$5,000, $8,000, $2,000. All right, I'm going to tell you guys. All right, you guys went a little high. 60 to 100 plus pounds, though, annually.
60 to 100 pounds
60
annually.
to 100 pounds.
I don't think they make a 100-pound bag of sugar, do they?
No way.
Because the visual of that would be interesting.
Maybe for like a pizzeria or a restaurant.
Yeah. Maybe a restaurant depot. But 60 to 100 pounds a year. Staggering.
I hope I'm closer to the 60 mark. I'd like
Yep.
to say.
You've got to kind of
I skipped those.
be aware of it. I'm not telling people never have any of it, but be aware of it. Try to keep it down. Kick up your exercise. Fine-tune your vitamins. Get on the vitamin pack as we talk about, because it's based upon your requirement based on your blood test. Do all the good things and watch to see how much better you feel. Then all of a sudden, that 60 to 100 pounds becomes very, very low. Becomes nothing.
My sister-in-law has something eating her blood. She has to keep getting blood transfusions. She's going to have the bone marrow tested to check if she may have leukemia. Sorry to hear that.
Blood transfusions typically means that the cells that you're supposed to make, whether it's red blood cells, and sometimes if it's iron for anemics, they have to put back in the components that your body's not making. So that typically would be a bone marrow issue. So yeah, that's the thing to look at.
Is it magnesium that is good to take for leg/calf cramps?
Magnesium, potassium, yeah. Because both of them are involved in both airways and smooth muscle. So, handy dandy little diagram thing here. This is a blood vessel. This is how it's branching off to go to different ways. But if you can see the yellow part, that's plaque. If you see the red in the wall of the blood vessel, that's the smooth muscle around that blood vessel. What does it do? It can contract to tighten the vessel and relax to open the vessel. So if you have low magnesium, potassium, you may have tighter blood vessels, which could raise your pressure. The same could occur in airways, where you have tighter airways with low magnesium, potassium. But when you have real good levels, the smooth muscle can relax and stay more open, which is far better for your blood pressure, and similarly would be far better for your airways because the smooth muscle would be relaxed and stay more open. So those are important minerals, obviously, for your blood vessels and your airways.
Love when you bring in the diagrams, Doc.
Yeah, we got to show pictures of things.
What are some good things to take or eat for anxiety?
For anxiety, the typical recommendations are low-carb diet, because too much sugar raises your blood sugar, you dump insulin, blood sugar drops low, you're anxious or panicky. So you'd want to do a low-carb diet. Snack every 3 hours on things that are vegetables and protein sources. Squash has lots of minerals in it, so that may be advantageous. I'm trying to think of other foods that would have nutrients that would be beneficial, but those are probably the two most significant things. Also, you have to test your hormones because hormone decline causes anxiety all the time. That's probably number one or two cause of anxiety. In women, decrease in estrogen, progesterone, DHEA, even testosterone in women, your levels should be 40, and most women are below that, unless they're real young. In men, low testosterone causes anxiety all the time. So an IGF-1, the active component of growth hormone, so I would test vitamins, minerals, hormones, and do low-carb diet with snacking every 3 hours or so. Again, based upon blood tests, but this is what we discuss with a lot of people that have anxiety and panic attacks.
All right, let me make sure I'm not leaving anyone out. My YouTubers. Listen, I'm sorry, Rumble takes the cake. Just kidding. I take potassium for that, so combo magnesium, potassium is what I need to change that a little.
But yeah, you got to check your blood. Remember, always check your blood. And for the minerals, it's red blood cell level for magnesium and potassium, not just your serum.
And then there was this follow-up from the previous question. Magnesium and potassium. Oh, never mind. We went over that. Okay. Caught up there. Sorry about that.
For those of you who are interested, certainly give us a call at the office, 516-794-0404. There's the number. We get lots of phone calls, especially after the podcast, so we just beg your patience and just leave your name and your phone number and what you're calling about so we can help you. The website's drcalapai.com, drcalapai.com. We talk a lot about the different remote monitoring that we're doing with blood pressure cuffs, glucometers. Now they're coming with watches, rings, and bracelets that can track your vitals. Medicare is covering this because they don't want you to get all unhealthy and lose your focus and control and end up in the ER for a $300,000 ER visit. But doctors love the idea that they can track your blood pressure and look at your numbers for a whole month or every day. Same thing with your sugars. It's automatically goes from the device into our computer. So it's genius. Just gives us a much better way to be able to handle and fine-tune and fix your issues. Maybe not as much with traditional medicine because they don't talk about low-carb diet. They don't talk about vitamins and everything else. But this is a wonderful addition to what we're doing. Then putting together the vitamin packs are a great idea because I create the pack based upon what you need from your blood test. And then you get a pack and you take the capsules in the morning and you take them in the evening and you're set. You don't have to have 20 bottles of things all over the place and not know what you're doing and not be hitting the nail on the head. Relatively soon, we'll have a platform that will enable you to look at any of your prior blood testing, put that into the platform with your name and your information, get AI to read your blood work or different samples of your blood work, and give you suggestions for diet, exercise, and maybe even nutrients, vitamins and minerals, but based upon how I create vitamins and minerals from the blood test, not just some random thing where AI would say, well, your vitamin D is 40, that's fine. No, we want to have your best levels of vitamins, the optimal level of vitamins. For vitamin D, you want to be at 80, 85. So you can get telehealth visits, and this is going to be open to people throughout the entire country. You can get telehealth visits. We have a big company that's going to be doing and taking those calls. Get on peptides, on hormones. So it'll be a lot of wonderful things that we're able to do with the help of AI. And AI has been such a spectacular addition for creating this. And this week coming up, I'm going to start toying with the, I guess, the administrative component of the platform where I could get on and I could ask AI to give me 50 articles a week on the latest research on vitamins and benefits and vitamin deficiency and disease, on different diseases and their statistics. I can get anything that I want from that, but not actually have to do the search and read all the abstracts and the articles because it'll give it to me directly. I'll be able to get on the article and press a button and to voice speak my comments on that article, good or bad, etc., this or that, and then send that to the lovely ladies who are doing my website and my social media. And as you put more articles on your website, your page becomes higher and higher up on the searching capacity of the search engines because you're putting in lots of new content, and then it goes out to social media too. We'll have a newsletter set up. So it's pretty amazing as to how AI can help you with all of this.
Is it, this is from Deb in the chat, is it advisable to do hormone replacement therapy after menopause? I am in my upper 60s.
I think so. You know, you wouldn't ignore your thyroid. You wouldn't ignore your DHEA, adrenal hormone. You shouldn't ignore testosterone, even a little bit of the female hormones, because you want your body to have good and your best function. So I think that makes a great deal of sense. But plant extract, not using the regular old school horse urine extract for estrogen, progesterone.
A lot of thank yous and excitement on the, system you just described.
Yeah, it's going to be really, really cool. I mean, there are not that many things that make me, make my thought process go crazy and get really excited. But this is something that, this is something that I would have wanted to do if I knew that it existed, if I knew that I could make it happen. So a good friend of mine, a partner in Florida, who's a coding genius and a genius with AI, and I talk to him literally every day, and we're finding out all of these other added benefits are just unbelievable. For example, in order to test it, beta testing is a term used for testing a mechanism to see if it's working right. So we took a whole bunch of made-up people, imaginary people, imaginary ages, imaginary blood work, and put them into the program just to see what the imaginary people's comments were about the whole mechanism, the ease of use, the AI nurse and the AI doctor that are part of the initial intake. And so the imaginary people had comments about the imaginary nurse and imaginary doctor. And they like this about the doctor. They like that about the nurse. They like this about the ease of use. And I said to myself, it's all imaginary. But it's real because a person who goes on there is going to have that experience just as a, quote, pre-programmed imaginary person can have that experience, and they could comment on what they liked and what they didn't like. And then as this is all up and running, we're making it also for Medicare as well, because Medicare has guidelines. And the AI was requested to make the entire program that took a few months to create, but would have taken years to create if it weren't for AI, and all tested out perfectly. We told the AI to please duplicate the entire Humalogix program for Medicare with its guidelines, requirements, this, that, the other thing. Click, done. So it's kind of staggering to me as to how quickly anything that you ask for can be just set up in front of you. So it's pretty amazing. And as we start to get the remote monitoring integrated within that, if people want to do that, they can. If they're Medicare, Obviously, we can go down that pathway if they're non-Medicare and they want to do that as well. It's just so I've changed the percentage in my mind of what medicine's going to be in the future. And I'm not trying to be a visionary, but I will tell you, absolutely. And I used to think 50%, then it went to 70%, 80%. I think 90% of your interactions with your favorite doctor, not a doctor they push you off to because the big business company bought the doctor's office and now they're manipulating everything. You'll call the doctor's office and say, hey, I want to set up a telehealth visit. You have the telehealth visit, whether a visual visit with Zoom or something or not, with your doctor. You're chatting about a whole bunch of things. He understands what to do. If you need to be seen, then of course you go to be seen. But if you don't need to be seen and you just need blood work done, they can send a prescription for blood work immediately. They can send a prescription to your pharmacy immediately. And then if you need to come in at any point, you can. It's just 90% of what's going to happen will be triage, like you used to see on MASH, that Mobile Army Surgical Hospital TV show. And when you need to be examined or have surgery or do echocardiograms, you can do that. Now, with the beauty of telehealth and being able to sort of more immediately understand and fix, because sometimes patients get to the doctor for 2-3 months. I've heard this. I hear this all the time because these big companies are taking over the doctor's offices, paying them. They put younger doctors in. You're not getting who you want. If you add on the RPM and a doctor does a visit with you, Mrs. Jones, wow, your blood pressure's great. You've lost weight. Your blood work is great. I'm totally happy, totally proud. Let's wean you off your blood pressure medication because you're doing so much better now. So the remote monitoring along with the telehealth and all of this makes your visit so much more worthwhile. You can get them done at any point that you like. And it's just better care of patients. What would you rather see? A doctor who has 3 visits a year looking at your pressure, your sugar, your arrhythmia, getting a Holter monitor 24-hour heart rhythm test done, or doctor sets you up for a watch, a ring, a bracelet, or a band, blood pressure cuff, glucometer, has your readings every day, looked at you and says, okay, I've looked at the past 2-3 months. I've got a ton of information on you. Everything's great, or maybe some things need to be adjusted. Would you rather have a little information and guess what to do, or a lot of information and know what to do? That's what doctors are understanding now and thinking. So that's why this is such a wonderful mechanism. So most of what happens is going to be fine-tuning and fixing with telehealth and with the remote monitoring. So I'm thrilled that I'm entering and starting and getting through this. We're already doing it as sort of the beginning of this tidal wave of intelligent medicine. So we can really track people and make them super healthy.
Comment in the chat, Irish539 says, this is great. This is my first time watching this show. I am learning a lot. Most doctors will keep you on meds forever and keep adding some. Sadly, many doctors are in cahoots with Big Pharma. We couldn't agree more.
So there's a comment that I make a lot because it's pertinent. Years ago when I was in training, and I've been in practice, I've been doing this for 40 years, there was a step care approach to high blood pressure. And you're supposed to get rid of the salt, change the diet, get them to lose weight, see if that works, then put them on a diuretic, and then try another med, a different class. They don't do the diet or any of that anymore and haven't in years. When they put you on a diuretic as your first pill, if it's a regular diuretic, not a potassium-sparing diuretic, you can lose potassium and magnesium when you're going to the bathroom and urinating more frequently. But if low magnesium potassium is the cause of high pressure, you're making it worse. Think about that. Very simple. And doctors don't test red blood cell magnesium potassium. I do all the time. They don't. If the diuretic doesn't work, they'll give you another pill, a beta blocker, calcium channel blocker, any number of things. But they don't get rid of the diuretic. If it's not working, get rid of it. So instead of having the diuretic and one or two or three of the others, you have them all on board, get rid of the diuretic. If it's not working, don't use it. I don't do that. And you see this all the time. So it has to be, there has to be a better mechanism. And as I say, with the remote patient monitoring and what we're doing with all of this, and being able to put your blood work into the computer, granted, I mean, I can't see 1,000 people in a month. Maybe if I drive by a stadium, I can't see 1,000 people, but to have this mechanism set up where you can have your blood work evaluated and recommendations can be made, it's brilliant. It's genius. So it's a great deal of fun to do this. Here's our QR code.
Oh, coming back. There we go.
And that talks about our Stay Strong longevity program. All the things we're doing that are integrated. So the evaluation, the blood work, the remote monitoring, the exercise, the diet, the vitamins, all of these things are part and parcel of the whole picture. And that's the way it should be, because that's where you get your best results.
All right, let's see what else we got. People loving the chatter today. We got Kit Kat Mar in the chat saying, my husband plays soccer and had developed calf muscle cramps, but stopped eating bananas because of sugar content. I started him on the magnesium potassium, so I wanted to know Dr. Chris's thoughts.
Absolutely.
Yeah.
Magnesium, potassium, check the red blood cell level to see if it's up. You could also have squash. There's more magnesium, potassium in squash than any other food. I think it's 2,000 milligrams. So for people that are, and everybody thinks, bananas, tomatoes, potassium, have squash. It's better for you. Tastes great. No sugar. Spaghetti squash, acorn squash, butternut squash.
We got someone in the chat says, are you on Long Island? I noticed you have a 516 area code.
Absolutely. Garden City.
Does telehealth take Medicare and secondary insurance United
Absolutely.
Healthcare?
Absolutely. So you can call the office, 516-794-0404, from any state and parts unknown. We'll, answer calls from aliens. We do a few of those every week from outer space. Give us a call. We'll set that up for you. We'll chat over the phone, you and I. We'll talk about what you're going through, et cetera, et cetera. Get your prescription sent to you for blood work. Get that done, review that, and make recommendations therein.
There we go. Said, oh, that's awesome. I am in Western Suffolk. Shout out. A local Suffolk.
Western Suffolk's not that far.
I'm a Suffolker.
There you go. Western Suffolk's good. Good town, good place. A lot of good places to buy healthy food, by the way. I know of Milosky's Poultry Farm, Milosky, apostrophe S. You can get amazing duck eggs, amazing organic free-range chicken, and you can get venison and all sorts of great stuff they have there. And that's on 25, right past East Wind Spa. And I'll go there to buy some good stuff because I don't want to buy stuff in the regular supermarkets anymore.
Done with that. Side note, different question. My grandma is having trouble controlling her bladder. What could she eat or do?
Well, we got to figure out why that's happening. For some people, it's a low back problem where the nerves that go to the bladder are being affected. Other people, it could be food allergy. They're eating a food over and over again that they don't know they're reacting to, and it's giving them a symptom. So we have to figure out what the cause is. It's not as though there's a vitamin or a food that will make something better without understanding what the cause is. And there could be a few different things causing it.
Deb, Hawaii Realtor, in the chat says, is there a way to get blood work done in Hawaii, Doc?
I'm sure there is. We send blood work to people all over the place and everywhere in the country. So we could probably email you the blood work request and take it to a big lab and have them do the blood work.
Look at us.
Yeah, pretty easy. And as I say, this whole mechanism of reviewing blood work. And certainly we have a lot of people all over the place that want to do this, and there are some people who just are never going to be able to come in, which is okay. And we could still help them, administer to them, and then the Hemologics mechanism will help for them.
Boom. All right. I love squash. We love spaghetti squash. Great idea. Thanks.
Love it. Always have, always will.
Oh, love good squash. What else we got to do? Can't forget my YouTubers, even though,
Butternut squash soup.
Oh, I was just
Come
going
on,
to say
people.
that. A little cinnamon on there. A
Yeah.
little cream. Oh,
Butternut squash soup. Summer squash, winter squash, whatever squash you can get. Squash made into pasta and zucchini made into pasta. Those are great.
yeah. Squash, one of those things you think is disgusting as a kid. You're like, ugh, squash.
Yeah, because it's not terribly sugary, and your palate hasn't really advanced to that yet.
Yeah, but something tells me if someone gave me some butternut squash soup as a kid, I would have loved it.
Yeah, it's so good.
What else we got? I am trying to take less pills and go more natural cures if possible. By the way, I love squash too.
There you go. So in order to get people off their meds, we have to understand the mechanism completely, all the underlying causes, contributors, and then start to take steps to fix things and then wean the meds down. So it's doable. Just takes a little bit of workup.
All right, what else? Chat's relaxed a little bit. Still got a lot of viewers, but
Do we still have callers?
let us
Is the
know.
call device
guys.
working?
Oh, yes. I've been putting the chat. I've been putting the phone number up here. We have
888-420-9272. If I'm correct, I haven't said that in a while.
You are correct, Doc.
You are correct, sir. Yeah, 888-420-9272 if you'd like to call in to ask a question.
Moment of truth. We finally had someone who wanted to call in,
Yeah.
and it's the one time I couldn't get it to work. We
That's
always have
right.
this thing collecting dust over here. Everyone
So
likes to
please
type.
tell your family, your friends, everybody you know about our program every Saturday, 2:30 and onward. I mean, what time is it now?
It is 3:45, but yeah, and
Awesome.
when we're not on Rumble on Saturday on LFA, we have YouTube, we're on our own Rumble, Dr. Chris Calapai, or the Optimal Health Program.
And we keep adding more and more of that to the YouTube collection. So we've got some good interviews coming up. I'm going to revisit a few people that we've spoken to, doctors in the field. We're putting out some very cool, brilliant vibes to RFK Jr.
Oh, yes.
We want you to hear this. So we can get him on the program.
Oh, and you should just mention, because you haven't mentioned today, and people that are watching or listening for the first time, just mention your stem cell background. What you
Yeah, so about 15, little more years ago, I was researching stem cell therapy because there was so much about the benefit of using your own cells to repair your body that I got into a clinical trial and learned how to extract the bone marrow in a minute and a half after we sterilize and numb the area. And you spin it in a centrifuge for a half hour. And we've treated a wide range of different things with some pretty dramatic results. You can see those on the website. So Alzheimer's, arthritis, COPD, diabetes, erectile dysfunction, frailty syndrome, heart failure, kidney failure, liver failure, MS, Parkinson's, stroke, all sorts of different things, joint disorders, hair loss, facial rejuvenation with stem cell. The brilliant mechanism is that these are your cells in your body, no drug, no chemical, no risk or side effect. We take them from your body, spin to separate them, take them out of the bottom of the centrifuge vial, and put them to work to repair your body to shut down the inflammatory cascade. So it's a pretty brilliant way to improve your function. And the answer to cellular loss over time is putting new cells into play. And that's why it can work so well for so many of these things. So, yeah, we tell people to look at the website. And we should have at some point a QR code for that. But we'll get that set up so you can look at that as well.
Does stem cell help for neuropathy?
It can, yes. We've seen diabetics with neuropathy where we do the IV, And then where they have the nerve issues, we inject the stem down that leg or down and around the foot to get right to where the nerves are affected. So, and if stem cells can help with Alzheimer's, Parkinson's, MS, which are brain-related disorders that are pretty bad, then you'd expect to see it work in other parts of the body as well.
And then a follow-up from the same person said, GP and neurologist have me on a ton of pills. It's crazy. I think it becomes a loop of more pills added on from the side effects alone.
That's typically what happens. It's multiple pills. There are some people who do well with alpha-lipoic acid orally, or in many cases intravenously, to help with neuropathy. But we have to figure out what the cause of the neuropathy is.
If you've had an I'm bad with this, guys. Allogenic bone marrow transplant. Can you allogeneic bone marrow transplant? Can you try stem cells to treat a type 1 IDDM of over 58 years?
So type 1 diabetes?
Type 1
insulin-dependent diabetes mellitus, IDDM. We've used stem cell therapy for lots of type 2s and a bunch of type 1s. And I think the ability to put new cells into your pancreas, because your pancreas is still connected to your blood flow, can enhance your body's ability to help to metabolize the sugar. What do they do the allogeneic stem cell for?
I'll give them a chance to respond on that. We got a few here, so we'll come back to that. Another comment, had my gallbladder removed a year ago. Anything I should be eating or doing to adjust for that?
The best answer for that is to really look at your vitamin levels. And as I mentioned before, if your magnesium, potassium's low, have some squash. We'll also recommend vitamins for you in a vitamin pack based on your blood test. If you're allergic to food and we see some antibody production, take those foods out. So to give you the best recommendations as to what to have for foods, depends upon, in part, your blood test, but also what your body's going through. A lot of people need more protein than they're having, so we have to raise protein. Other people need to cut the carbs down more because they'll burn down cholesterol, triglycerides, LDL, bring weight down. So, the diet, and there's obviously a saying, use your food as medicine. The diet's an integral part of being healthy because what you put into your body makes you healthy or makes you sick. And we'd want to know about your body and then tailor it according to that. That's the best way to say it.
And then back to that previous comment, they said for the transplant, it was AM leukemia.
And how long ago was that?
The first comment had said over 58 years, but I don't know if that was the IDDM or the type 1. So just clarify that for us. Another comment, why does my dad's heart race every day, every time he eats carbs after 6 p.m.? Crabs or carbs?
Crabs are good.
Carbs.
Because either there's an allergy to the component of what's in that carb, in that food, or there's a GMO component of that food because it's not pure, or there are chemicals in the food. So allergy, GMO, and chemicals could do that. And some people, they just randomly eat carb. When their sugar goes up, their body just starts to do kooky things. So that's not unusual. But I'm a big carb reduction person for reasons, for many, many, many reasons. Cutting back on carbs for people that have stomach and bowel disorders, irritable bowel, colitis, Crohn's, it helps to cut the carbs back. People that want to lose weight, it helps. Lower cholesterol, triglycerides, LDL, help clear up your skin. I've seen that happen unexpectedly. People have cut the carbs out, all of a sudden their skin clears up. There's no more pimples. Sometimes it's hard to understand the mechanism of exactly why it's happening, but you see it, and you realize it.
All right. We're still waiting on that follow-up, but up to date here on questions, I believe.
Yeah, so the mechanism with people that have cancers.
Oh, here we go.
They do stem cell for that. I can't do it because I'm not an oncologist.
Bone marrow transplant for acute myelocytic leukemia. In 2007, type 1 diabetic or insulin since 90.
Yeah, that's
68.
Certainly doable because 68. You're, 9 years out from having the bone marrow transplant. So, yeah, you could do it.
More than that. right? 9 years.
Well, 7 and
2007.
oh yeah, longer than that. Yeah, yeah,
Time's
longer.
flying.
19 years.
All right. 18 years, 19. Yeah, 18, 19.
Yeah.
years.
So when I talk to people about STEM and putting everything else aside, you're taking your cells from your body, not somebody else's, not umbilical, not amniotic, God forbid, aborted fetus. You're taking your cells, putting them back in to fix your body. There's no drawback to that, no downside. So it's a brilliant idea. I didn't create it. I'm not that old. But Dr. Haeckel, 160 years ago, was the first person to call it a STEM, and then research has been exploding. And I tell other people, because they say, oh, does stem cell really work? I say, yeah, I can show you tons of patients, videos, et cetera. You can talk to patients in the office now that have done it. Then I said, oh, one more thing. Clinicaltrial.gov is where all the clinical trials exist that the government approves. So if I want to do a new surgical procedure, if I want to do this, that, or the other thing, I petition, they review it. It takes time, a couple of years, and then they allow it because they know it's going to do what we asked to research. Because if they don't have evidence of that within existing literature, they're just not going to allow it. But they've allowed stem cell therapy to the tune of 10,000 clinical trials. 10,000 clinical trials, not 1 or 2 or 5 or 10 or 20. So they know the validity and the value of it, and it's being done for just about every degenerative disease known to man. And then you can see on some of the other sites and Instagram and such that all the countries throughout the world are doing stem cell research. And some are saying that it helps to improve vision dramatically, and it's going on and on. So it's one of these things that's exploding, appropriately so.
Slightly changing subject, but is H. pylori a result of parasitic infection, or what causes it?
It's its own bug. Helicobacter pylori is a bacteria that can cause stomach cancer. So it can get and sit there in your stomach and cause you to have indigestion and bloating and miserable symptoms. And doctors test for it. And if it's there, they can give you combination medications that kill it. But it's a bug that you want to get rid of. It's its own bug. It's not a parasite or a hookworm, pinworm, or other parasites that exist, Giardia and all the others. It's a bacteria on its own accord. It does its own thing. You don't need a parasite for it to be there, and vice versa. But it's pretty common. There is some evidence using olive oil every day, maybe a tablespoon of olive oil could help to kill infection in the stomach. And I think one of them that they talked about was Helicobacter. But you got to test for it.
Really enjoying the show. Have you come across any alternative therapies for wet and or dry macular degeneration? Thank you.
For wet and dry macula, I think STEM is probably the best mechanism because you're putting brand new cells into the bloodstream. You're also dripping into your nasal cavity stem cells, so they hit the back of your nasal cavity, get into the blood vessels, get into your brain right by your olfactory bulb, so your sense of smell improves. And we've seen people with macula. There's a video of macula on our website, and we've seen diabetic retinopathy improve. So you're putting new cells into the area of damage to make brand new cells, just like you would for a stroke patient, MS or Parkinson's or Alzheimer's. So yes, stem cells by far the best mechanism because you're answering the question as to why the macula is degenerating, it's losing cells, and you're putting new cells in to create repair. There's no vitamin or mineral or drug that can do that, nor can it do it for liver, kidney, heart failure, and all of the other degenerative disorders. The meds aren't meant to do that, but your own cells are.
It's amazing because I've met so many patients of yours that, you change their life with your treatment basically. And now I'm seeing people in the chat that are just realizing how powerful stem cells are.
Yeah.
It is insane.
It's one of the greatest things that exists in medicine, but it's not that, what word do I want to use? It's not someone placating you and saying, here, just take these pills, pills, pills. Let's see what happens. We'll try this. We'll try that. You know, people are kind of tired of the pill, pill, pill and no result.
Any ideas how people can fall asleep fast?
Some people like chamomile tea. Some people use a Benadryl, an antihistamine. Other people might use magnesium glycinate. Some people use melatonin with theanine, and what else is in there? A company named Olly, O-L-L-Y, makes a combination of 3 or 4 different things that's good for sleep, including melatonin. Some people, if their levels of IGF-1 are very low, the active component of growth hormone, correcting that is amazing for sleep because that helps to make your neurotransmitters that allow you to sleep and get good deep sleep. I'm trying to think of what other things people might use, but it's got to be based upon,
CBD and
CBD. You know, there are some people that, and I have no problem with that at all. Some people that use, let me change my position here a second.
Yeah, sometimes
CBD and some with THC in it. And there are gummies that people use. There's sort of a new way of using CBD with or without THC that doesn't involve an oil, because some people will cough incessantly from trying to breathe in that vapor with the oil, etc. And as I'm told, Pax, P-A-X, is a company that makes a device with a little chamber where you would grind up the product and put the powder in the chamber, press a button, it heats up, and then it's just a mist without oil that you'd be inhaling that gives you the effect. CBD or CBD with THC. So it's not a chemical like the vape thing. It's just putting ground up parts of that flower into the chamber, it heats it up, and you're breathing that in. I have a lot of patients who do that with good results and no coughing. It's also good for glaucoma, by the way. Or people might have questions on glaucoma.
One more question that I see here. We hear a lot about grounding. What do you think about it? Grounding.
I mean, walking outside barefoot?
I don't know. Grounding, is that like electrical grounding? Is that what you're talking about?
Oh, there are different things that can be done. Some people will hire a company to come in and look at the electric coming into the house, and sometimes the electric is sort of going all over the place, and they try to contain some of that aberrant electrical flow. There may be an advantage to that. And there are people who like to walk barefoot, as I do. I love to be outside barefoot. You know, the history of shoes in this country, okay, in my perspective, was that when you were young, you'd buy these hard, painful shoes because they would last forever. It would kill your feet, but your shoes would last a long time. I hated that because your feet were always achy. And then as I got older and did better and was able to afford nicer shoes, I would buy nicer shoes, which were better, but still, you know, if you're on your feet all day, I used to work at a clothing store, high-end clothes, high-end shoes. My feet were killing me all day. And some of the shoes were expensive shoes back then. Ferragamo, whatever. After a while, you say, oh, I don't want to wear these shoes because they're killing my feet. So recently, and of course you can put in those little gel cushion things because the commercials show you how you can do everything and put the gel in your shoes, gelling like Magellan or something like that. And that's more comfortable, but Cole Haan makes shoes that are super comfortable. It feels like you're wearing a sneaker, but it's got a leather top like a loafer or an Oxford. So that's a heck of a lot better, you know, for your feet. So I believe your feet should be super comfy. Walking outside on the grass, on the beach, there are people who believe in the electrical flow and what you're absorbing from the goodness of the earth can certainly enhance your health. And I agree with that. You look at populations of people who've existed for thousands of years, and they did that. Look at the Native Americans. They were some of the healthiest, strongest people, and a lot of them, were running barefoot, distance, as if they, because they didn't have these hard, uncomfortable shoes. So I believe you should be very good to your feet. Now, that's an inside joke. Do you like your feet? It's an inside joke that only a few would know. I'll explain that on the next show. But, yeah, you should be as comfortable as possible. Yesterday, I did 3 workouts because I had my day off. I went to Bev Francis Gym, which is a big bodybuilder gym, great gym, all new equipment, gigantic gym. Steve, the owner, is awesome. We're going to interview him here on the show maybe next Saturday. He judges all the competitions for fitness and this and that. Amazing guy. He's become a patient. And I did a workout with Derek Panzer, who's a famous trainer for MMA and all the fighters. So we did weights workout. Then we did a boxing workout, which is intense because you're punching and hitting and hitting and hitting, and you're constantly doing it. And that was exhaustive. And then in the afternoon at 3 o'clock, I went to my karate school and we did a karate workout, hitting bags, hitting pads, drills. So by the end of the day, I crawled home, sat on my couch and said, okay, I'm just going to drink a lot of fluid. I may sit in my massage chair, get a little massage, and go to bed early. And I did. And I still feel good. I wasn't wiped out exhausted. I was appropriately tired, but I've done this enough to know that, wow, you know what? I'm feeling better when I work out. I could last longer and feel better even when I'm not working out. So this is sort of the time of year for me to push. So we'll probably do 3 to 4 karate workouts a week, weights 3 times a week. The kickboxing, I'm pushing to do as much as I can. Anytime I have spare time, I just go do something. So it's good. It's fun. I don't think everybody has to be that crazy, but if you can do it, do it. You'll feel it, and your body will feel great.
Just a few more questions to get through. Your discussion about vitamin B earlier was interesting. Is oral methyl B as effective as intravenous methylated B? Thank you.
Well, oral, no matter what you do, there's probably never 100% absorption of anything, even sublingual. When you do a shot of the methyl B12 or intravenous, which is the ultimate way to get it into the highways to go all over your body and be distributed everywhere, is the ultimate way. So if we do vitamin IVs, vitamin C or a peroxide IV, PK Glut, we'll put the methyl B12 in the IV, so boom, it's right into your system immediately. For those people who have the defect of the gene where you don't convert, we'll give them a bottle of the B12. They'll give themselves shots at home, sub-Q, and that'll go right into their blood vessels and get into the system pretty quickly. So yeah, oral is the least absorbable mechanism of nutrients.
Can a hyperbaric chamber or aspirus help with cancer? Was this asked?
There is some evidence that using hyperbarics is beneficial with cancer because cancer doesn't like a high oxygen environment. There are complementary and integrative cancer doctors all over the country, all over the world. And a lot of them, if they can set it up, they'll have hyperbarics. But remember, you've got to be on the first floor because you can't take a multi-1,000-pound chamber and put it on a high floor in a building unless the building is super, structured. But yeah, I think hyperbarics can be great. I'm certified in hyperbarics. I used to do it years ago.
Mary I Am says in the chat, I love this show. So glad I happened upon it. Plus, I get to see Frankie. Oh, that's another real one.
Frankie is going to become a celebrity. We know this. We know this is happening. He's got his fan base. Thank you, really, for everybody for watching, and all new people. Tell your family, friends, tell everybody. We broke 300,000 some odd. We want to break 400,000 now, and it hasn't been. It's not even a year and a half yet.
No, we hit a year in January. So
December.
December.
So a year and a half would be May, right?
Yeah. Wow.
Less than a year and a half. This is awesome. I love this stuff. I love talking about all this stuff.
And then real quick, one more question on green tea. What is green tea? Any benefit? I think that may have been when we were talking about sleep.
Green tea is great because there's documented anti-cancer benefits of green tea, antioxidant benefits of green tea. It's good for your gut. So we tell people have a glass of green tea every day, 1 or 2. Makes sense. Everybody. Get some good organic green tea and drink 2 cups a day. I could probably pop on and get articles on it, but we'll save that for the next show. But green tea is great. I like it.
All right. Pretty much up to date.
Okay. Big, long show today.
Love it.
Did we go more than a half hour?
Yeah, 8 minutes over.
8 minutes over in 2 hours?
We're at 99 minutes and almost 100 minutes.
All right. Well, we'll have to wait till we get to 100.
All right. We got about 50 seconds. So
Just
this is your
say
last.
that we were able to get to 100 minutes.
This is your last call. Peeps.
I could do this all day. I love this stuff.
Someone said a lot of great and helpful information.
Love
Thank
joking
you.
around with people, teaching us some stuff, getting to learn, look, read, getting people to expand their knowledge about different things. It's important.
What's better, matcha or green tea?
I don't know. Some people love the matcha flavor. I think it's probably similar in its benefits.
Yes.
So it's hard to say. I don't know if they've done a side-by-side study, but either or I think is good.
Someone in the chat said, we're just missing Mike Crispy. Hey, listen.
Yeah, the Crispinator.
We've all had a nice dinner, us three.
We have, and we love him. He's a great guy. So we want to, and we try to get together with him, but he's a busy guy, and he's not right around the corner. So every time we chat with him, we always laugh and have a great time. And we just got to figure out how to get together with him, and his schedule's a little easier.
He's a busy man, that one.
We should call him today and bug him. Can't be too busy on a Sunday, so maybe we'll try to get him together on a Sunday.
There we go. All right, we're at 100 minutes.
All right, there we are, 100 minutes of pearls of theoretical wisdom and good stuff. Thank you so much for listening. God bless you all. Give us a call at the office, 516-794-0404, if we can help you out. The website is drcalapai.com. Learn about vitamin and mineral testing and correction, hormone testing, peptide recommendations, remote patient monitoring, our new mechanism with Hemologics. We'll keep talking about all of this as time passes, and we'll promise to give you a lot of good information. Thank you so much. Thank you, Frankie.
Yeah.